Hello, everyone. Happy Monday. I know you weren't expecting to see my face today, but we have a surprise in store. Me. Hello. Hey, everyone jumping on. Hey. Okay. Looks like we got a couple people on. And I'll just wait for Paul to pin the comment, and we can go ahead and get started. Okay. Hello, everyone. Happy Monday again. As you know, during the COVID-19 pandemic, Whitman-Walker's Health Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STIs, social determinants of health, and access to care. The community health team is here to educate and support you. Once again, my name is Marshawn. I use pronouns he and she, and I work with Whitman-Walker Health to bring educational Instagram lives to this platform. Today, we're going to discuss something new. We're going to discuss the new drug-resistant gonorrhea strand, and of course, ways to get tested. Public health officials announced they have found 2 new cases of gonorrhea that appear to have received vulnerability to every kind of antibiotic available to treat them. This is the first strand of gonorrhea that is resistant to antibiotics that have been identified in the United States. The COVID-19 pandemic resulted in an increase of sexually transmitted infections due to the increase of sexual activity and fewer people getting routine checkups, which of course supercharged the spread of the sexually transmitted infections around the world. The number of syphilis cases in the U.S. rose about 70% between 2019 and 2021, and although not as steep, chlamydia and gonorrhea cases increased as well. According to the CDC, 2.5 million cases of these 3 STIs were reported in 2021 alone. Of course, those infections include gonorrhea, which are becoming extremely resistant to antibiotics, as I mentioned, and this is definitely creating a problem to public health. Globally, infections that are resistant to antibiotics kill approximately about 700,000 people each year. That number is expected to rise to 10 million deaths by 2050 if steps aren't taken to stop the resistant organisms. Gonorrhea, as we know, is a sexually transmitted infection, and it's one of the more common infections, which is caused by a bacteria called Neisseria gonorrhoeae, which can infect the mucous membrane in the genitals, rectum, throat, and eyes. Gonorrhea is contracted through sexual contact with the mouth, vagina, penis, or anus of an infected partner. It can also be passed by a pregnant mother. It can also be passed from a pregnant mother to their infant. Most women are asymptomatic, which means that they aren't aware, according to the CDC, and even when symptoms are present, they're often so mild that they're mistaken for a vaginal or bladder infection. However, initial symptoms in women include increased vaginal discharge, vaginal bleeding between periods, or painful urination. Many men are also asymptomatic, but their symptoms appear a little differently. Symptoms of gonorrhea in men include white, yellow, or green discharge, which appears between 1 and 14 days from infection, painful urination, and scrotal and testicular pain. Rectal infection symptoms in both men and women include itching, soreness, painful bowel movement, discharge, and also bleeding. A gonorrhea infection can also be present in the throat, and a sore throat is also a symptom. If left untreated, the infection can also cause pelvic pain in infertility in women and blindness in newborns. The CDC recommends annual testing for sexually active adults and testing every 3 to 6 months for those with multiple partners. Latex condoms, when used consistently and correctly, can reduce the risk of transmission of gonorrhea. Although the surest way to avoid transmission of gonorrhea or other STIs is to abstain from vaginal, anal, and or oral, or to be in a long-term, fully monogamous relationship with a partner who has been tested and is known to be uninfected. Timely identification as well as a rapid public health response are essential to keeping patients safe and reducing the risk of community transmission. We must all remain alert, stay safe, and protect ourselves. Thank you, everyone, for joining us. Of course, I like to end things by saying be sure to honor your queer identity in 2023 by taking more opportunities to prioritize your own needs and happiness. While on the topic of testing, before I go, I want to share a few reminders about HIV and STI prevention and testing services available through Whitman-Walker. You can learn more about Whitman-Walker's health testing hours and locations at www.whitman-walker.org/testing. HIV and STI testing are available by appointment at both our Southeast and Northwest locations. Feel free to call our phone number, 202-797-4439 to schedule a testing appointment, and be sure to check out our website and Instagram for the most up-to-date hours. If your community or organization is interested in Whitman-Walker providing mobile health services in your neighborhood, please contact Mobile Health at whitman-walker.org. To access HIV prevention tools like PrEP or PEP or start treatment with HIV with Whitman-Walker at our Max Robinson or our Northwest location located in Logan Circle. COVID-19 updates. I know I mentioned COVID-19 earlier, and here are just a quick reminders about the COVID-19 vaccine. If you've already been vaccinated, congratulations. You've taken a really important step in preventing yourself, your loved ones, and your community from illnesses. Multiple variants are soaring across the world, and it's totally understandable why you might not want to keep wearing your mask. The vaccine isn't 100% effective, and as more contagious variants are spreading, and there are very few protocols in place to actually verify if folks are actually vaccinated. So please stay alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccine available. Please reach out to us at 202-207-2480 to make an appointment. And if you're having any trouble, you can always call the testing line. For DC residents, you can find more information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine, discuss COVID precautionary measures with those around you, and be mindful of masks and keeping your distance, but especially when you do not know whether the person has been vaccinated or not. And last but not least, a quick monkeypox update. According to the CDC, there are more than 29,000 cases of monkeypox documented in the U.S. In DC, walk-up vaccinations will be provided on a first-come, first-served basis to eligible residents, and hours may vary upon location. You can pre-register for the monkeypox vaccine appointment and learn more at preventmonkeypox.dc.gov. Virginia is currently working with local care providers to contact trace and identify those most in need of the monkeypox vaccination. Varying counties in Maryland are allowing residents to pre-register for the monkeypox vaccination, and the Maryland Health Department just released a pre-registration system. Please visit your local state's health department for more information on how to register and get vaccinated against monkeypox. Be sure to follow us on social media on IG, as we're on now, Facebook and Twitter at Whitman-Walker, and check out our website, www.whitman-walker.org, for the most up-to-date information on our hours and services. For more COVID-19 resources and general Whitman-Walker health services, please call us at 202-797-4439. And be sure to follow the Whitman-Walker family at RealTalkDC_ and at NoFilterDC. Thanks everyone for joining me today. Have a good day. Well, night.